In this presentation, we're going to go over measurement and sampling. And while we are talking about it in context in terms of your health promotion planning, and we do want you to think about and to utilize it within the health promotion planning that you'll be doing, a lot of the same methods and same definitions and understanding can be applied to epidemiological studies or field investigations, research studies, or any time that we're wanting to have a method in order to make sure that our data that we get at the end is accurate. So I just want to let everybody know that while you will possibly apply it to health promotion planning, you may come across it in other classes and other aspects of your job or in other fields and areas. Measurement is defined as the process of applying numerical or narrative data from an instrument or other data yielding tool to objects, events, or people. Examples of an instrument are questionnaires or surveys. They are a tool that you utilize to collect data or information about a population. The data generated by measurements is classified into two broad categories depending on how they are collected and the type of data that they yield. Quantitative measures are data traditionally represented with numbers to show patterns and trends within large populations. Qualitative data are traditionally represented with words such as stories or quotes from subjects that provide contextual understanding about a population. It's usually organized into codes and themes. Quantitative data can statistically represent the entire population. It's data gathered with close-ended response options on surveys or information from databases such as healthcare records. By close-ended, what we mean is it's a yes or a no or a very defined response. It can be analyzed with traditional statistic methods. It's used to show patterns and trends in data. Examples of quantitative data that you might come across are immunization rates in developing countries, patient satisfaction scores, attitudes towards mask wearing in a pandemic on a population-wide online survey. When we talk about qualitative measures, they can actually reflect a portion of a population. It's data gathered with open-ended response options on surveys or through techniques such as interviews, focus groups, or observations. When we talk about open-ended questions, what we're really trying to understand is the why or the how. So you might ask with open-ended questions, there's no defined response. You're going to collect specific words and feelings from people and then look at the themes that you've collected. A good example of a open-ended question is why do you have hesitancy towards vaccines? Qualitative data is analyzed through exploring core themes. It can actually provide contextual understanding to the population. Examples are interview transcripts about women's experience with breastfeeding for the first time, observational studies of hand washing practices, focus group transcripts about barriers to physical distancing during a pandemic. A fundamental question of measurement is deciding how you're going to measure something. An example of this is trying to get data on the income level of a program participant. You could ask, which of the following categories most closely corresponds with your overall household income? Poor, lower middle class, upper middle class, or wealthy? You could ask categories in terms of a numeric response, such as 0 to 10,000, 10,000 to 25,000, and so on. Or you could just simply ask, what is your annual household income, and have them fill it in. So when we talk about this, we're really talking about levels of measurement. And there are 4 levels of measurement, including nominal, ordinal, interval, and ratio. The nominal level is mutually exclusive and exhaustive response option list. It categorizes people, places, and things. It is used for non-parametric statistical testing. Examples of this are race, religion, and marital status. Ordinal is mutually exclusive and exhaustive response option list, but these are rank ordered categories. You are unable to determine the specific distance or difference between two categories, and it too is used for non-parametric statistical testing. Examples of this are marathon race ranks and anything measured with a Likert scale. Interval is mutually exclusive and exhaustive as well, and it's rank ordered, just like ordinal, but it's continuous data, with the difference between two categories being the same. There is no absolute zero when we talk about interval, and it is used for parametric statistical testing. Examples of this are temperature, aptitude tests, or credit score. Ratio is mutually exclusive and exhaustive. It's rank ordered. It's continuous data where the difference between two categories is the same, but it has an absolute zero, which makes it different than interval, and it is used for parametric statistical testing. Examples of this are amount of sleep, salary, time, or the time spent exercising. A needs assessment or the results from a needs assessment are actually only as good as the data that is collected. Because of this, we have to make sure that the data we collect is reliable, valid, and unbiased. Collectively, these are known as psychometric qualities. When we talk about these qualities, we are talking about the instrument that we have developed to collect the data. We need to make sure that that instrument is valid and reliable, and that there is no bias that exists. Reliability refers to the consistency in the measurement process. It is the empirical estimate of the extent to which an instrument produces the same result applied once or two or more times. No instrument will ever provide perfect accuracy, and when we talk about reliability, we talk about it in terms of a coefficient, where the less error that exists and the more reliable it is, the closer R is to 1. The more error that exists and the less reliable that the instrument is, the closer the R is to 0. There are a number of different types of reliability. Internal consistency is also known as inter-item reliability. This is when there is consistency of scores for people over items or sets of items. So it means that you're asking the question and people are understanding that question and answering it appropriately. Stability reliability is also known as test-retest reliability. This looks at consistency over time. It is achieved by giving the same subjects the same test after a determined period of time. Common statistics that prove this are correlation coefficient or Cohen's kappa. When we talk about rater reliability, there are actually two types. There's inter-rater reliability, which determines the consistency between two raters who are scoring the same item, and intra-rater reliability, which determines the consistency of one rater over a series of events. Equivalence reliability is known as the parallel form reliability. It determines whether a similar form of the measurement instrument given to the same subjects will yield similar scores. An example of this are your ACT exams that differ in content each time it is administered. When coming up with your own or choosing your data collection instrument, you have to ensure that you're measuring what you're intending to measure and that the data can support the conclusions and that the proposed data interpretation is actually reasonable. All this collectively is what is known as validity evidence. Using an instrument that produces valid results increases the chances that planners are measuring what they intend to measure or the intended variables. Valid data increase your ability to make conclusions on the effectiveness of the program or the intervention. When we talk about validity, we are talking about our data being consistent and accurate. There are a number of different types of validity. Face validity determines if items appear to measure what they are supposed to measure. It is actually the lowest level of validity. Content validity refers to the extent of the items covered. Criterion-related validity is evidence showing how well the item measures the construct compared to an already known standard. There are actually two types. Concurrent, which is the score on a measure can predict the present standing or status of a trait, and predictive, which is the score a measure is able to predict the future standing of a status or trait. Construct validity is evidence showing whether the instrument is measuring the underlying construct. There are actually two types of this as well. Convergent is whether two measures that claim to be measuring a similar or theoretically related construct actually are. Indiscriminate, whether or not the instrument can actually distinguish related constructs. When we talk about validity, we also have to talk about sensitivity and specificity. These are actually terms that are used in healthcare, public health, and epidemiology to express the validity of screening and diagnostic tests. Sensitivity is defined as the test's ability to correctly identify those who have the disease. It is recorded as the proportion of true positive cases correctly identified as positive on the test. The better the sensitivity, the fewer false positives. Specificity is defined as the ability of the test to identify only non-diseased individuals who do not have the disease. It is recorded as the proportion of true negative cases correctly identified as negative on the test. And the better the specificity, the fewer the number of false results. In order to collect the data, like we've talked about, you're going to have a measurement instrument or a tool. This is really a survey or some way to collect data. Before creating your own instrument or your own survey, it's very beneficial to look to see if one already exists that will collect the data that you need. There is a lot of time, effort, and resource that is needed to create a measurement instrument with good psychometric qualities. Because once you've created the instrument, you need to check it for reliability and validity and make sure that there's no bias present. That is one of the main advantages of using an existing instrument. The major disadvantage is that a lot of times it doesn't contain relevant questions or appropriate questions for the program that we're implementing. In order to look for measurement instruments, you can start by searching literature to see what others have used. You may not find an actual copy of the instrument, but it should tell you or reference where the source was found. A lot of times, data collection instruments are available through the U.S. government and federal agencies, as they've created a number of health-related data collection instruments that are available on the public domain. Once you've identified it, you will have to either call, write a letter, or email requesting a copy of an instrument just to make sure that they're allowing you to use it. Sometimes there is a fee that is associated with it, and so you may need to check and pay the fee prior to using the instrument. Once you receive a copy of the instrument, it's important to consider several questions. Is there sufficient evidence of the instrument's validity and reliability? Was it used with participants similar to yours? Are standard or normative scores available for various participants? Is the instrument culturally appropriate for your participants? Has the reading level of the instrument been determined, and is it good for your participants? Is there a cost to administer the instrument, and can you afford it? If you can't find an instrument that is appropriate for your population or for the health program that you're trying to implement, you may have to develop an instrument on your own. You could have to create questionnaires for an instrument to conduct a formative research or measure program success. And in general, you need to think about those surveys and that collection tool in terms of the wording. We need to make sure that the wording is appropriate, and it's extremely important in gaining the needed information and data. There are guidelines to help you in terms of asking the correct questions. We also actually want to consider our response options. We have to determine what the format for the response options are going to be. You have to actually consider what type of question you ask, and the response options will generate, and which response options will generate the data that you need. You will also want to consider the presentation. Every survey, whether you administer it by phone, email, or the internet, should include a cover page, which is the survey title, a survey title, the purpose statement, a statement about the confidentiality of answers, instructions for how they will fill the survey out, and you may also need to include instructions on how they get the information back to you. You also have to consider the appearance if you're doing mailed surveys. You need to allow for ample white space, indent the response options from the question stem, because the indent sets the responses apart from the question. Bold the question stem, indicate any skip patterns. Skip patterns are words that direct them to go to a specific question based on how they respond, such as, if no to this question, skip to question 13. List all questions and response options vertically from top down. Group related questions together. Lastly, you need to ensure that the survey is designed and coded for easy data entry and analysis. Where you can, use checkboxes next to response options. It's a lot easier when doing data analysis. Code the response options. Coding means that there is a number associated with every option. And never ask respondents to check all that apply. This is really difficult in terms of data analysis. Once you have your measurement instrument selected and developed, you're going to need to select participants that you'll work with to collect the data from. Depending on the size of the priority population, you could want to collect data from all participants, or maybe just a sample. If you collect the data from all participants, that is a census. If you decide that all participants is too big and unwieldy, which it can be, you will need to collect it from a sample or a portion, only some of the participants. A sampling unit is the element or set of elements considered for selection as part of the sample. When we consider this, we have to consider sampling bias, which is the difference between the sampling estimate and the actual population value. Sampling bias can be reduced by controlling the sampling procedure. That is how we go about selecting the sample. The ability to generalize the results from the sample to the entire population or to the census and to the survey population is greater when sampling bias is reduced. We reduce sampling bias through doing probability sampling. Increasing the likelihood that the sample is representative of the survey population is achieved by random selection. Randomness minimizes the likelihood that a systematic source of selection bias will occur among the sample, thereby influencing the population's degree of representativeness. There's actually several different types of probability sampling where we are using a random selection. When we talk about simple random, an example of this is a researcher obtaining census data for a state or a city. From that list, they assign a number to each person. They utilize a random number generator that you can get on the internet or a table of random numbers to select people that need to be interviewed. This strategy would take a lot of time depending on how big your population is. A systematic sample also uses a frame and takes every nth person, which is determined based on the size of your population, beginning with a randomly selected individual. An example of this is you obtain census data for your population. Then you utilize a random number generator for a starting point and then select every 7th person if that's what the random number generator stated. Or maybe the random number generated said 102. So every 102nd citizen will be receiving your instrument. Cluster sampling is actually when we obtain census data that is organized through different bureaus, through different counties, or through different schools. A cluster sample is completed when a researcher obtains a list of groups, takes a random sample from the groups, and then surveys all the individuals in that group. A stratified random sample is if certain groups have to be represented in the sample, we utilize this. This method would be used if we felt that there are certain independent variables, such as size, race, income, or age, that could influence our data. A stratified random sample might also be used if it's believed that representatives from that group may not be selected using a simple random sample due to small numbers of a certain group in a survey population. A proportional stratified random sample would be used if we wanted the sample to mirror in proportion the survey population. That is, we want to draw out companies in the same proportion that they are represented in the survey population. So say there are 600 small companies, 350 medium companies, and 500 large companies in a population. We would want to then select 60 small companies, 35 medium companies, and 5 large companies if we're going to do a proportional stratified random sample. There are times when we can't do probability sampling and it's not realistic or feasible. Non-probability samples can be used when we can't identify or contact all those in a survey population. These samples can be used when resources are limited and the probability sample is too costly or time-consuming. In such cases, non-probability samples in which all individuals in the survey population don't have an equal chance or probability of being selected to participate. We have to understand that there are limitations to this type of sample when reporting results. Bias may occur because those who are not included in the sample may differ in some way from those that are included. Additionally, we may have issues in terms of generalizing the data to the entire total survey population. These are all considerations for non-probability sampling. Examples of non-probability samplings are convenience sample, which occurs when participants can be included based on their convenience, maybe because they volunteered, or they're available, or you walked out the door and they were there. Homogeneous samples are conducted when people who share similar characteristics or traits of interest. An example of this is a first year students and looking at their transition from high school to college. You're looking at a population that has similar characteristics. Snowball sampling is a method in which a respondent is asked to identify others who fit the study criteria. So you would identify a population, maybe through convenience sampling, and then ask if they know others that fit the study criteria, and then go look at them. It's often used when there's difficult to find priority populations or to find information-rich respondents. A quota sample is completed when researchers choose subjects based on whether they meet pre-established criteria, aiming to have a certain number of respondents with specific characteristics. A maximum variation sample is completed to ensure that there is a diverse representation of the priority population by selecting a wide variety of people possessing characteristics and experiences. Here are the references for the presentation.